guys, April Green here, registered nurse at the Cosmetic Surgery Center. Today we're going to be talking about blepharoplasties. There's different ones that Dr. Bremen performs. There's an upper and lower and a complex. So we'll let you know exactly what you're getting whenever you consult with him. So you'll know a little bit more about that. But it kind of all has the same information, and some of your sutures will dissolve and some will actually have to take out, but that's really the only difference. But if you haven't already went and watched the general surgery information video, then go ahead and watch that before we get into this video. This one is kind of long, so just bear with me if I kind of have to read off the page a little bit more. So we'll go ahead and start. So the items that you'll need at home is your lab work and an eye exam. You'll need to get that before surgery, and we'll need to look over it and make sure everything checks off before you get surgery. You'll also need prescription medications, and you'll get those at your pre-op, but you'll need to go to Walmart or Walgreens or something to pick up some Gentil gel and Gentil drops. That's Gen and then T-E-L, or T-E-A-L, I'm sorry. And then you'll need a bag of frozen peas and some small Ziploc snack size baggies to put those frozen peas on, and you'll put those over your eyes after surgery. And then some hydrogen peroxide and Q-tips to clean your incision sites with, and of course sunscreen, a hat, stuff like that. Or stuff like that as in something to cover up your incision sites and make sure that the sun's not getting on them. So you already talked about this, we already talked about this during the general surgery information video, but I kind of want to reiterate it here, and that is to bring a button up or zip up top that we can put you in, because we don't want to bring anything over your head and get in your eyes or anything after surgery. And that this is a surgery that you have to stop smoking 6 weeks before and 6 weeks after. But that's really it on the what you need to know before. Now we'll talk about after the procedure. So after your procedure, you're going to restart your antibiotic medication and your Cosmetic medication with a light meal to avoid any nausea after surgery. You're not going to sleep with a fan on, because this can kind of dry out your eyes more after surgery. So no fans, I know that's hard. And then to minimize swelling, oozing, and bruising, you're going to try to suppress any forceful coughing or sneezing for at least 7 to 10 days after your surgery. You're going to keep that ice pack or the frozen peas over your eyes for about 12 to 24 hours after surgery. If it's getting too cold, you can put like a little bit of like a Kleenex on and then put it on there, or like some little gauze pads, whatever works for you. You're also going to sleep for the first week of your surgery with your head elevated. So that could be in a recliner, or it can be in your bed propped up on 2 to 3 pillows. And that's just going to help with swelling also. So no lifting anything greater than 10 pounds after surgery, and avoid bending forward a lot. Also avoid any strenuous and aerobic activity for about 4 weeks after surgery. If bruising does occur, it should be gone within 2 to 3 weeks. Now this is very important, y'all. This is talking about a complication that could result in blindness. So if you ever notice any severe pain and swelling in one or both eyes or decreased vision, then definitely give us a call immediately. This has never happened, but the usual cause of this would be abrupt bleeding behind the eye. And it normally would happen within that first 12 hours after surgery. So if you ever notice any of those signs, then give us a call. A low-grade fever isn't too abnormal after surgery. Just take some Tylenol, increase your fluid intake, and if it doesn't go below 101.5, then give us a call. And then if there's any sudden profuse bleeding, like on your incision area, then definitely give us a call for any of that. You might have a little bit of oozing out of it for the first 24 hours or to 72 hours, and that's normal, so no worries there. But like I said, you are going to need a hat, sunscreen, avoid the sun for about 3, 6 to 12 months. And that is going to just protect your incisions from any darkening colors or pigments. So be sure and do that. Don't drive and take your pain medication, obviously. No using eye makeup until Dr. Bremen gives you the okay, and that's normally for about 2 weeks after surgery. Obviously, no stretching, pulling, or tugging on your eyelids for 4 weeks. You'll have your next appointment after surgery. We'll give you your next appointment, and normally it's within about 4 to 6 days after your surgery. So this is talking about the eye drops or the eye gel. So at night, you are going to apply the Gentle gel in both eyes for the first several nights before you go to bed. And that just is going to help with that eye dryness. And then the drops you can use throughout the day if your eyes feel dry. But make sure you're buying that specific kind. Don't use any of the eye drops that get rid of redness. So you can start wearing eyeglasses at any time after surgery, just no contact lenses for about 3 weeks. And normally Dr. Bremen will let you know whenever you can start using your contacts again, but it's normally about 3 weeks. Okay, so now we're gonna go over kind of like what to expect after your surgery. So discomfort, it's normally just minimally discomfort and easily controlled with pain medication. Like we said, you'll have mild to moderate swelling and bruising in the eyelids and tissue surrounding the eyes, maybe even the cheeks. It just varies based on, you know, if you're a bruiser, big bruiser normally, you're probably going to be a big bruiser in this surgery. But decreasing the salt intake and sleeping with your head elevated will help with that swelling part of the surgery. Like I said, a small amount of blood tinge fluid oozing from the incisions for the first 24 to 48 hours is normal. Just be sure not to blot too hard on your eyes if you are noticing that, because that might displace that Steri-Strip dressing if you do have a dressing on there. So like we talked about, your incision area, it'll be a little bit reddened and feel firmer to the touch. At first, it takes about a year for the incisions to mature or get lighter and soften. Like I said, avoid sun exposure, and that'll help them not hyperpigment. Numbness, you might have a little numbness of the eyelids for the first several months until the sensory nerves regenerate. Sometimes you might notice a little bit of burning in the eyes when shampooing, dry eyes upon awakening after sleep, and occasional blurriness when reading. And that's all due to swelling and early wound healing and should subside with time, usually in a month or 2. So as far as care of your incisions, if you do have that little Steri-Strip on your eyelid, leave it there until your post-op visit, which is normally about 5 days out. And if you don't have a Steri-Strip there, then you're going to clean the incision area with a Q-tip and peroxide twice daily. So like in the morning and in the afternoon. And then most of the time your sutures will dissolve on their own, but on occasion non-dissolvable sutures will be used and they'll be removed in our office. So like we already said, your post-op visits, the first one will be about 4 to 6 days out. And then Dr. Bremen will tell you any other appointments that you need to come to for follow-ups. After that, he'll just make those for you based on your healing and everything. So really that's about it, y'all. There's a couple more things in here that just goes over the consents, but you'll get this little packet at your pre-op before surgery. Thanks guys, we can't wait to see ya.